Today we're going to talk about fitness. As you know, I have a 27,000 square foot wellness center. We don't offer fitness here except for anti-aging and other types of treatments for obesity and aesthetic work, spas, salon, etc. But we don't have the fitness component. But fitness is one of the major components in terms of wellness in general. I've gone through some testing called MAP testing through a place, Lifetime Fitness here, which I think has been really amazing. I wanted to share that information with you guys. I have no affiliation with the company. I'm not a paid sponsor. I get no money from any of the products you're going to hear me talk about today. I just want to talk about it because I'm very passionate about it, and I think it was something that's great. In fact, I'm not even a member of Lifetime anymore. I've moved over to LA Fitness, which is closer to me. You can still actually get your testing at Lifetime Fitness without being a member there. But this testing has so radically changed the way that I actually do cardio that I want to share it with you because I think it's very informative. When I first started doing cardio about, many years, but before 2007, I was just thinking the harder I work, the better it would be for my body, and actually it's not the case. I went and did this test January of '07, a year ago, and when I first did the test, the lady said, "Boy, what are you doing? You're training at a heart rate of 165 and it's actually above your what's called anaerobic threshold." And I was realizing I was killing my muscle, I was storing fat, and I was destroying my body at a heart rate of 165. Actually, interesting to me right now is that 165 is too low a heart rate based on my new studies. This test called MAP testing, I don't know if it's offered anywhere else, I'm sure it is, but it's offered at least, I know, through Lifetime Fitness, which is here in Dallas and Plano, and there's locations throughout the country. Basically what it is if you understand that during fitness there are 5 zones that you're in. Zone 1 is a early workout time where you're just sort of it's fat burning, but you're really not doing much work. The zone 2, you're actually getting more workout, you're building that up, and you're mainly in a fat burning mode. Zone 3, you're in a heavier fat burning mode, but you're still aerobic, you're still burning off fat and not glycogen storage. When you get past your anaerobic threshold, you get into zone 4 and then really peak performance, which is really not necessary for most amateurs out there like myself. You don't need to get up to that level, is way above your anaerobic threshold. What's great about this test is during the test you wear this mask and they're actually measuring your oxygen CO2 with your heart rate monitor, and what they find is that there's no subjectivity, there's no operator bias. It's actually, they can tell exactly where your anaerobic threshold is, and they can tell you exactly based on your O2 CO2 exchange how much fat you're burning, how efficient you are per kilocalorie at every single zone. And what I found was initially when I was training at 165, I was above my anaerobic threshold and I needed to train low. So I started to train in my heart rates of 120. So you got to have a heart rate monitor. And really it's almost like what I would say is like driving a car without a speedometer. You don't know what you're doing. Now I know all my zones, and if you look at your age and that is useless. It really doesn't give you except a very skeletal idea of where your anaerobic threshold is and where your zones are. You need this test. This test will get you there. So what I found with this is that after training over a year, when I went back and retested about 3 or 4 months later, all my numbers shifted 10 points. So my anaerobic threshold went from 160 to 170. So where I initially was overtraining, I was actually training in my sweet spot between my heart rates of 120 to 160. I went back and just recently retested in early February, which was a long delay. You should retest every 3 to 4 months, but I didn't test it for 6 months, and my anaerobic threshold went up to 190, and the trainer who was sitting next to me said, "Boy, I can't even get my anaerobic threshold that high," which is great. So now I was having a hard time getting to that AT at 190 because I was working so hard to get up to that level, and I realized because all my training has been too low now. So based on these numbers, I know where my efficiency and where everything is, so it really is helpful to get this test done. So you know what you're doing, and you can actually train yourself appropriately based on the numbers. The other thing I just did for the first time is something called a resting metabolic rate, or RMR, where you sit in a dark room for about 20 minutes with a mask on with an O2 CO2 and a heart rate. And what I found was the number of kilocalories I was burning per day was actually quite low, about 1,600. I should be about 2,500 to 3,000. And what's interesting, the reason I'm having that problem is I wasn't eating enough food. So now I try to get a good breakfast in. I try to eat smaller meals 3-5 times a day with higher protein loads. And that actually is funny, is counterintuitive again. But the more I eat, the more I'm going to burn, because it's like a furnace, your body, and you have to keep on throwing coals on it to continue to burn it. Otherwise, it tries to conserve the fat. So it's not a good thing. So all those things I thought were helpful for you. And it's the first time I did my RMR. I'm really glad I did it, because it gave me that understanding of what my baseline kilocalorie burn is, besides just my athletic training for my heart rate. Also, when all your numbers go up, besides being healthier, if I'm burning at 160 heart rate, 170 heart rate, I'm burning more calories, and I'm burning more calories efficiently, and I'm doing better for my body. So it's a really great test, the MAP test, M-A-P, I actually don't know what it stands for, but MAP testing, as well as the RMR. A couple things with heart rates. Again, I don't have any financial affiliation, but just to help you out, I've got a couple here. This one I really like. It's a Polar. It's an RS200 for runners, but it really gives you all your zones, your 5 zones. After about 3 or 4 weeks, you pretty much memorize your zones, but it's a good heart rate. It's about $150 out there. And then the other one I have is a SUUNTO, which aesthetically I like better. It's SUUNTO, but I would really not recommend this for 2 reasons. One is the fact that the SUUNTO only has 3 zones of training. This one has a standard 5 that we use more commonly, at least what I'm familiar with, or most charts are familiar with. And also the SUUNTO doesn't work with most of the cardio machines. This one does. So, most, in the United States at least, most places use Polar compatible cardio machines. Anyways, I thought that was a good introduction to some fitness parameters that were very helpful for me over the last year. I wanted to share that information with you, especially considering, even though this is not plastic surgery related directly, it is the over idea of wellness and fitness, as well as aesthetics. Thank you.